Here on the Morning Blend, we love to give medical news and maybe different treatments that can help a patient. Well, so many patients may hear a cancer diagnosis, if you will, and think of radiation. Well, how about an advanced alternative to those traditional ways of doing radiation? And the first on the west coast of Florida. Well, that is what's happening right now at the USF Health and Morsani College, TGH. Dr. Richard Tooley is with us now. Good morning, doctor. How are you?
I'm well, thank you. Thank you for having me here.
Well, we are glad you're with us because we love talking about the latest technology that is out there because it's always evolving, as we know. So let's first talk about this different way of looking at radiation treatments and why it's more advanced and will work better for some patients out there.
Absolutely. So we are truly very excited to be able to bring the first proton therapy center to the west coast of Florida. Proton therapy is really the most sophisticated and advanced form of radiation treatment that we have to offer. The individual proton particles travel very precisely to tumors. They remain within the tumor. They deposit all of their energy within the tumor, and they really are very effective in helping to kill those cancerous cells. Additionally, they allow us to simultaneously protect the normal tissues that often surround the cancerous tumors. And this allows us to minimize side effects, both short-term side effects, long-term side effects, also including risks of secondary cancers, which may sometimes be related to radiation. Proton therapy is actively being researched in almost all types of cancers that we treat, and to date has really been shown to be most effective for cancerous tumors that are either close to vital organs, for patients who have already received a prior course of radiation treatment and now require a second course of treatment, and also for our pediatric and young adult patients for whom proton therapy is really considered the best standard of care.
So you gave examples there of how it's going to change what the patients are impacted, other side effects that may happen, if you will. What are some of those other things that you are seeing as far as the patient care, the day-to-day life of patients who are undergoing a treatment like this?
Well, our patients in the Tampa Bay region really don't have access to the sophisticated technology nor the necessary expertise. So, our patients, both adult and children who need proton therapy, have to travel either across the state, sometimes even out of state, away from their homes, often their families and their jobs, to receive these critically important treatments. And this is especially challenging because the number of treatment doses can often average between 1 to 5 weeks, sometimes even 6 weeks, making it critical for those who are seeking the treatment really to be located close to a proton therapy facility.
I'm so glad to hear that, just to be able to have that option right here close to home. Again, big thanks to TGH. You can go to their website for more information, tgh.org. Dr. Tooley, thank you for sharing this with us today.
Thank you for having me.
Take care, okay? And of course, that's the website one more time, tgh.org, and there's a phone number too if you want more information on this treatment or much more.